apologies, we're recording the session, so you'll have all probably had to agree to that, hence why that booted me out for a moment. Apologies, everybody. Oh, we've still got a lot of people joining. Just going to take a moment just because we've got a lot of people still joining. Didn't expect it to be this popular. I think that's a good sign. Right. Okay. So welcome everybody. Older people cost of living information sessions for professionals working the voluntary community sector and also the statutory sector. This session will give you information on how to support the people that you're working with, and also where to signpost for support. My name's Christy Thacker. I'm head of the Community and People Wellbeing team, which sits within Hertfordshire County Council, and we've been leading the cost of living response for Hertfordshire, working with working in a multi-agency way, so working with all our partners. So this session is being recorded. Please can you so we I think we've disabled cameras and microphones. If we haven't done that, please do keep your microphone on mute and your camera off. We've got a lot of people on this webinar. What we will do is we're going to go through a series of presentations with a lot of information in there, and then there will be times to ask questions at the end. However, if you have any questions, please pop them on the chat and we'll do our best to respond to them there and then. If we can't, we'll take that away and get back to you. Like I said, there will be chance to ask questions and answers at the end, but we do have quite a bit of information for you. What we will do is we will add this recording plus all the slides to our cost of living page on the County Council website. I will pop that into the chat later, the link, so you'll be able to access that. Okay, hopefully that's okay with everyone. So we have got quite a few presenters for you. Rather than going through everyone now, I will introduce them as they speak. So the first person to speak is going to be Gary Vox from the Money Advice Unit. Gary, can I hand over to you?
Certainly can, yeah. I can't see the screen yet, though, Matt. All I can see are the people. That's it. Okay, thank you very much.
I can see the screen. Can you
see
I've
got it
Gary?
Now. Yeah. I was asked to do sort of where we're at in terms of the cost of living, and later on I'll be saying a little bit more about what the Money Advice Unit does and a few things as well about what's happened in the budget. Obviously, we know that cost of living peaked dramatically 2 years ago, October 22. It was up to 11.1%, which is the highest it had been since the 1980s. It's now fallen down to about 2%. In September, it actually fell to 1.7%, so it's climbed back up again this month. And the September one's quite significant because the September rate of 1.7% is what is used to determine benefit increases in April 25, although pensioners are exempt from that and they get a different uprating, which I will come on to. So although inflation is no longer high in terms of year on year, you've got to remember it's building on top of very substantial price rises over the last couple of years. So it's not that inflation is coming down, it's just not rising as quick, and it's starting from a higher base. Next slide, please, Matt. Office of National Statistics did some research on this to see where are people feeling the pinch. It's one thing to talk about figures and inflation rates. It's what does it mean to people? And asking a survey of people back in September, 92% said the biggest impact for them was on the price of food shopping. Not surprising because that has gone up by more than any other measure of inflation. Followed by energy bills. There's been some easement, obviously, of that, though that will change again in January, where prices will rise again. Petrol, rent and mortgages, public transport, price of childcare, all of these are noticeable, but the key ones are food and fuel. Next slide, please, Matt. And it's low-income households who are most affected by food and fuel. They spend a higher proportion of their income on those measures. So any increase for them over and above the official inflation rate, if you like, will bear on them most heavily. And the estimates are that although the official inflation rate is round about 2%, the inflation rate for low-income households is much more around the 3.5–4% mark, because of the amount of their income, their limited income, which goes on the most things that have been rising in price the most, food and fuel. And it's lower income households who suffered the biggest fall in the value of their regular income, be that from wages or benefits. Next slide, please, Matt. One of the ways this manifests itself is in what we call material deprivation, where we're looking at where households are saying what they could and couldn't manage. And the numbers of people in what we call food insecure households has risen from 7% in 21–22 right up to 11% last year. And it's likely to be higher again from figures that we're seeing so far this year. When we see that 2.3 million people have used a food bank within the previous 12 months. Now, older people have tended not to be heavy users of food banks. We think there's a number of reasons for that, access being one of them, actually physically getting out to a food bank, but also issues around pride, being in the same local area as the people who are providing the food. But older people have tended to be lower users of food banks. But that obviously then, it's like hides the problem of food insecurity for those households, because at least if you're using a food bank, you've got some measure and some means of dealing with that issue. Next slide, please, Matt. Looking at the issue of bills, one of the issues is financial resilience. And when a quarter of households are saying that they couldn't afford a one-off expense of £850, that gives an indication of how little leeway many households have, where they've got a big gas bill or water rates bill or repair to a boiler or something of that nature. They simply don't have the resources even to cover £850, which for some of us may not seem to be a huge amount. It's substantial, but it's not the end of the world. For many people, that would be an insurmountable barrier. Next slide, please, Matt. So what did we get in the budget? Well, two issues there. One is the state pension triple lock, where the pension and pension credit goes up by either the rate of inflation, the growth in average earnings, or 2.5%. The previous government introduced it. The present government have said they will maintain it for the life of this parliament. And what it means is that although inflation is officially 1.7%, the state pension and pension credit are going up by 4.1%, which is the average rate of pay rises. So April 25, we are seeing pensioners getting a more generous settlement, if you like, than other benefit claimants, although allowing for the fact that for the low-income household, the official inflation rate is probably more around 3 to 4% anyway. We're also seeing a change for carers. There's a very low earnings limit at the moment for many carers of £151 a week. If you earn more than that, you lose all of your carers allowance. That's going to go up to £196 a week, and that will keep pace with inflation from then on, which it hasn't done in the past. And some of you may recognise the characters there from Crossroads, which actually generated the whole Crossroads Care scheme as a result of that particular programme. Useless bit of TV trivia there for you. Next slide, please, Matt. What we also learned in the budget was that we're going to be saying goodbye to housing benefit in the not too distant future. The government intend to merge housing benefit with pension credit under the control of the Department for Work and Pensions. Housing benefit for working age people is already going into universal credit, and that will be completed by April of 25. But now the government are saying from 2026 onwards, new claims for housing benefit won't be accepted. People will be directed towards pension credit. There's a good side to that, because it means that those people who have missed out on pension credit, even though they're claiming housing benefit, may now get noted and will get some help. Our experience, though, is that many pensioners are happier dealing with their local housing benefit service than they are with the Department for Work and Pensions. So it's a bit of a two-edged sword, that one, and it'll be interesting to see exactly how that plays out. Next slide, please. We know about the Household Support Fund has been awarded again for another year, £1 billion over 12 months. It's not all coming to Hertfordshire, unfortunately, but some of it is, and there'll be an item later on in this webinar about the Household Support Fund. Next slide, please. We saw the rise in employers' national insurance, which it appears that local authorities will be exempt from having to pay that extra. But many organisations that local authorities commission from, charities, voluntary organisations, or care homes or care providers, and GPs.
None of them.
Hello, I can hear somebody in the background. Could you turn your microphone off, please? Those people don't appear to be exempt. National Council of Voluntary Organisations said that alone will add 1.4 billion to charities' costs, and let alone any increase in the national living wage. So we expect quite an impact of indirect costs to local authorities as those costs get passed on by the organisations who work for us sometimes on contract or commission. Okay, fine. Next slide, please. Which means I hand over to whoever it is comes next.
I think we're handing over to Mark Hanna, who's the Chief Exec of Age UK Hertfordshire.
Thanks. Great. I'm not sure if this slide is displaying as clearly as possible, but essentially one of the main things I wanted to talk about is the winter fuel support roadshow that we're going to be, well, we have started already. So this is a series of drop-in events at 100+ locations between now and the end of March. So the Hospital and Community Navigation Service, or HCNS as it's known, will be going out to all of these venues over the next 5 months and providing a drop-in where local people can go to talk to them about a range of different issues. But the primary kind of focus is, because of the removal of the winter fuel payment for people who are not in receipt of relevant benefits, namely a pension credit, there are a number of older people who are going to be detrimentally affected if they're just over the threshold for pension credit but still on a low income. So the kind of cohorts of people that we're hoping to reach are firstly the people that are entitled to pension credit but don't claim it for whatever reason, and that could be for a number of different reasons, like the length of the application, not having all the relevant information and supporting evidence to make an application, such as bank statements and national insurance number and that sort of thing. and they're going to miss out of the winter fuel payment just because they have got a barrier about how to apply for pension credit. So that's one group of people that we want to support. The other group of people are the people that are just over the income threshold for pension credit, but could be eligible for other benefits that could mean that they are actually entitled to pension credit. And I'll go into that cohort of people in the next slide. But so there's a whole conversation there about reaching people who don't think they are entitled yet, but could potentially be entitled to pension credit following certain other applications. The third cohort of people that we're aiming to reach through these roadshows are the people that are over the threshold for pension credit, regardless of any interaction with other benefits, but still on a low income. And we want to reach them and speak to them about other financial support available through the welfare assistance scheme, but also white good vouchers that will be available to people in those situations, and the wider system of support that's available, whether that's winter welfare checks or referring on to other support services and such forth. And that's why having the link workers under H&S are ideal, because they will be able to provide that social prescribing aspect to that conversation. And the fourth cohort of people are potential carers that are yet to be identified and supported. And so there is a whole focus on carer identification to ensure that people who they might not see themselves as carers, or they may do but not want to access any formal support, to try and get them into that kind of network of support. And the reason for that can be a variety of different things. It could be to make sure that they can access peer support and mentoring, and also to have the practical support around contingency plans and such forth, to make sure that their caring role is sustainable. So those are the kind of four cohorts of people that we're targeting, but the roadshow is for anyone who wishes to talk to the social prescribers about any aspect of concern or that they have. So the roadshows are being delivered via H&S at venues across Hertfordshire, in warm spaces, healthy hubs, libraries, and with a focus on diverse communities, to ensure that we're reaching as many people as we can who otherwise might not know where to go for help or ask for help because of any perceived barriers. The locations of these drop-ins are on our website. So if you go to Age UK Hearts, not Age UK National. So if you go to Age UK Hearts website, on the homepage, you'll see a link for the Winter Fuel Support Roadshow. You click on that link, and then you'll see the list of venues where we've confirmed where we'll be, and that will be regularly updated. So it's always worthwhile checking in on that page to see where new venues are added. But it's a way of just trying to get out there in the community to reach people who otherwise may not pick up the phone or contact us. So it's a proactive push to try and get to those people. Next slide, please. And just back onto the point where I made that the second cohort of people are those that are not entitled to pension credit yet, but they may have care and support needs, or they might be caring for another person, and it is very specific to their situation, because there's certain factors that come into play, whether they are counted as living alone, and the interaction of other benefits. But essentially, the thresholds at the moment for pension credit for people who are not in receipt of the relevant benefits for care and support needs, or carers allowance, or the underlying entitlement to carers allowance, the income levels are fixed each year. So for this year, a weekly income for a single person without those other needs would be £218.15. So if you're over pension age and you're single, that's the rate. So you compare that to what income you have, and there are certain things that are considered to be income that we need to look at. And the rate for the couple is £332.95. So essentially, if a person's income is below those thresholds as things currently stand, then they're entitled to pension credit, and pension credit can top them up to that level. However, if they're just over that, it means they're not entitled to pension credit just right now. But if they've got care and support needs, they could potentially be looking at an application for attendance allowance, which, if successful, that could impact those thresholds. Equally, if they are looking after another person who is in receipt of the relevant disability benefit, they could qualify for carers allowance. Carers allowance overlaps with state pension, but if they're not entitled to any money from carers allowance, they will be entitled to something called the underlying entitlement, which can then push the pension credit thresholds up again. So it's part of a more complex conversation because it's very situation dependent, and each situation is different. But the reason why we mention it is because we're really encouraging people who may feel that they're not entitled to pension credit to come and speak to us, so we can link people in to benefit advice agencies and things like the benefit calculators, and also to contact the pension service directly to make applications. So it's really just to kind of make people aware that it's sometimes not as straightforward as comparing your current income to the thresholds, because there are certain interactions which can affect those thresholds. Next slide, please. So in addition to that, so that we're rolling out the roadshow funded by the Household Support Fund as a big push in Hertfordshire to try and reach as many people, to encourage them to talk to us about their financial concerns this winter, and about the support that is available via the Household Support Fund and beyond. Some of the practical assistance that we can provide is also really important to know as well, because there are people that will be missing out on the winter fuel payment, or may not be missing out on the winter fuel payment, but they're still on a low income, because obviously pension credit is just to top people up to the minimum level of income that the government recognises. So what we're trying to do is encourage people to speak to us about potentially some other kind of practical services. One of them is the winter welfare visits, where we will be able to visit people in their homes and provide practical things to improve the energy efficiency in people's property. This isn't the only service that does this, and we're working in partnership with others that are doing the same, such as the Green Doctors. But it's about just making this point to say, look, there's the financial conversation about what support people might be in need of, and we're ready for that conversation. But it's also the wider support that older people will need throughout the winter, and this is just one of those examples. So I suppose the summary of this is that there is a very proactive campaign and project in play to try and reach as many people, to make them aware of the support available, and that's the kind of summary of that part from me. Thank you.
Right, so I think we are back to Gary, who's going to talk to us a bit more about what the Money Advice Unit do.
Yeah, thanks very much. As you can see from the slide, we are particularly concerned about, as Mark has said, and absolutely correctly, about the low take-up of pension credit. We think there are about 15,000 people in Hertfordshire who are missing out on pension credit. It could be higher. Mark again mentioned the low take-up of attendance allowance, vital in itself, but also as a trigger to extra pension credit in some cases. We also see that pension credit, that housing benefits, for older people, before it disappears, has got a very high take-up. But the take-up of council tax reduction for owner-occupiers is actually very small. There are many, many pensioners who, because they are owner-occupiers, think they will be outside of the benefit system. They sometimes believe even that the value of their own house will disqualify them from benefits. And that is simply not the case. Whilst they're living in that property, the value of the house is ignored. And yet many people seem to think that is in itself is a barrier. So there are a lot of mythologies about pension credit which need to be dispelled. Next slide, please. And Mark, again, correctly mentioned those who are just missing out on benefits. We refer to them as the jams, the ones who are just about managing, where their pension is putting them above the level where they get pension credit, but that excess is very small and sometimes literally counterproductive. If somebody is £2 a week above the pension credit level, they're losing £100. They're £100 a year better off than somebody on pension credit, but they're missing out a £200 winter fuel payment. So sometimes that excess, even if it's very small, can actually be counterproductive. It's not just leaving them above pension, missing out pension credit. It also means they miss out other things that you get from being on pension credit. Next slide, please. So talking about some of the mythology that exists around pension credit, at the bottom of this slide, you'll see a link to a DWP video, which actually addresses many of those mythologies about value of property or what counts as savings and what effect savings have. A lot of people think that pension credit has got an upper savings limit. It doesn't. It's one of the few means tested benefits where you can have more than £16,000 in savings and still be eligible. There's some very good DWP material in their own online toolkit. The information from the DWP on this issue is actually quite good. There's also information about additions to pension credit, things like the warm home discount scheme and cold weather payments, which can also kick in as a result of being on pension credit. Part of the example of the knock-on effect and the need to claim pension credit and it not being counterproductive. Next slide, please. I just want to show a very quick pension credit case study here. We've got a couple in their 70s. They've got a reduced state pension, maybe because an incomplete work record, but they do have a private pension. Pension credit threshold for couples, £332.95. The total of their income is £301. They would be entitled to pension credit of £31.45 a week. It's not life-changing, but it's life-enhancing, and it will make a substantial difference to their ability to manage. And I've just seen in the chat there, can you please remind me of the single person's income for pension credit eligibility? Normally 218, but you'll see on the next slide that it can be higher than that. Next slide, please. And it's what a difference AA makes. Here we've got Madge. Risk of falling. She's got her retirement pension and she's got a works pension and she's living alone in her own house. The pension credit requirement is £218.15 a week. That's the normal pension credit for a single person. So therefore, her income is just too high to get pension credit. She's on £221 state pension and £30 works pension. So she's what, 40, just over what, 40. Oh, my maths is rubbish, isn't it? Anyway, she's above the pension credit threshold. But she applies for and gets attendance allowance. And that transforms the situation. No one's getting carers allowance for looking after her. The pension credit requirement goes up. It's no longer £218.15. It's now £299.65. She's classed as a disabled pensioner. So her pension credit requirement goes up. So now, instead of being substantially above the pension credit threshold, she's now below it to the tune of £48.45 a week. Plus, of course, she gets the £72.65 attendance allowance. And she'll also qualify for the winter fuel payment so long as she gets her claim in by December the 21st, because pension credit claims can be backdated for 3 months. Next slide, please. The final thing I want to mention are what we call mixed age couples. There's a picture of an old man, Gary old man, and his younger wife, because Gary's 66 and Giselle is 61. Previously, they would have been able to claim pension credit because it was based on the age of the older member of the couple. For new claims since 2019, they'd be directed towards universal credit. And I've just given an example there of how they would claim universal credit. Rather than a weekly benefit, it's a monthly benefit. The rates are different, but we get these mixed age couples, and there are obviously many mixed age couples where eventually one reaches the pension age before the other does. If that's the case, they would be looking at universal credit, not pension credit. But these are the sorts of examples where, as Mark said, a lot of them are very dependent on your individual personal situation. And this is a good example of where getting good advice from Age UK, Citizens Advice and other organisations really does pay off. Okay, next slide, please. This is just saying some of the areas where the Money Advice Unit does operate. We're not an open door advice service, unlike the organisations I've just mentioned, but we do a lot of casework around particular issues, particularly people affected by cancer, people who attend the renal unit at Lister Hospital, people who've got a disabled child, people with a brain injury, people with a mental health issue through Hearts Partnership Foundation Trust. In the last full year, we supported 5,738 households, and we gained £24.75 million in additional benefits for those households. Next slide, please. We can offer casework support. We've got fact sheets. It tells you where to get them. We do training courses, and we've got an online training course for you to complete. It takes about an hour on benefits for pensioners, and it's a standalone course. You can do it in your own time. You can do it. You can drop it in and out, whatever. We've got a daily advice line for professionals, not for the general public, but you can ring our advice line or send us an email and you'll get support. And we do a quarterly online magazine for information about benefits and finance as well. Next slide, please. Which brings us up to Charlotte and Citizens Advice.
Thanks, Gary. Hi, everyone. My name's Charlotte, and I'm here to represent Citizens Advice and give you a little bit of information about who we are, what we do, and then give you some top tips to have up your sleeve for the people that you support. So we are Citizens Advice, and we are a free, confidential and impartial advice agency. We're a voluntary service, and our goal is to help everyone to find a way forward, whatever problem they face. So Citizens Advice is made up of 10 independent local offices in Hertfordshire. We're operating in each of the districts of Hertfordshire, and we work together to develop the provision of advice services. It really works for us to work in this way because we're able to adapt to a really hyper-local level, making sure that we meet the needs of the different districts and the nuances of them. But we can come together to provide bigger services where the needs of the residents align. And people come to us with all sorts of issues. There's no standard inquiry that Citizens Advice get. There'll be things from benefits, housing, employment. They might be in crisis mode, or they might be just considering their options. And we deal with all of those issues holistically. We are really driven by making sure that we deal with the whole person to make sustainable solutions for them. Next slide, please, Matt. So, as I said, all of our advice is free, independent and totally confidential. It's a really safe space for someone to really get their issues out and organise them and make a plan to move forward. Whatever problem they're facing, however big or small, our team are there and focused on helping them find a way forward that's completely centred on their situation and their needs. We're made up of teams of volunteers and paid staff members. All have a really intensive training programme to make sure they've got up-to-date knowledge and expertise, and we know how quickly things can change, so everything is always at the most relevant information at the time. So what I wanted to let you all know here is that sometimes you just don't know where to send someone or how the different issues interact with each other. So our main inquiries are benefits, debt and money, employment, consumer, housing, family, law and courts and level 1 immigration, and soon we're going to be having the capacity to have immigration at level 2. We provide generalist services right up to casework, so we can be as light touch or intensive as the residents need us to be. And on this slide, I've just outlined the services that are available consistently across the county. So no matter what district you are, you can access these services. But I really would encourage you to look at the local districts' websites to see what different services they can offer their residents, because quite often they most closely align to their needs. Next slide, please, Matt. So what I wanted to do today was really just give you some top tips. It's really hard out there, and it is really hard when you're seeing people who are in genuine need, and sometimes we don't have instant answers. But there are some top tips that you can share with the people that you're helping. One of our biggest concerns this year is that, as we've seen in previous years, some of the most vulnerable residents, whether they're families with multiple children or whether they are older people, turning off their heating, and that can have real detrimental impacts on their health. So there are 5 affordable tips to stay warm this winter. First one being to turn the thermostat down by 1 degree. That will save around £105 a year on energy bills. Our colleagues over at the Hearts Help team have some excellent thermostats which people can put in their house. It shows you the safe levels of temperature. Anything over 22 degrees risks high bills. Anything under 17 degrees risks poor health and risks to health. Switching the heating off when leaving the house for a few hours. We always hear lots of different stances on this one, but it certainly is more cost effective to switch the heating off, unless the resident is on a heat pump, in which case that is not the most cost effective option. Fitting draft proofing strips to your windows and doors, that saves around £45 a year, so please do get in touch with Mark's team and the Green Aiders. And then keeping furniture away from radiators, making sure that the heating system doesn't have to overwork. The really nice aesthetically pleasing radiator covers cost more money. And there's just all of these different tips, like turning the lights off. We all know this saves around £7 a year. Not overfilling the kettle saves around £29 a year. So there's some real practical tips that you could share with people so that they can feel like they can put their heating on and they know how to use it in the most cost effective way. That said, I do just want to make sure that you're all very aware of what our team could do in terms of energy advice. So our teams of energy advisors and caseworkers have specialist knowledge of the full range of energy issues. We can help people to implement behavioural insights that I've been speaking to you about just now. We can deal with debt and disconnection, metering and billing, look at pricing and tariffs, energy efficiency, negotiate payment plans. So if you do come across anyone that you support that is worried about their energy, please do feel empowered to share these top tips and then connect them to Citizens Advice, where we can do a more in-depth review of their energy situation with them. Thank you very much, and I think I'm handing over now.
Thanks, Charlotte. I'm going to hand over to Michael Longfellow, who's going to talk through the Hertfordshire Welfare Assistance Scheme.
Thank you very much. I work in Christie's team and I manage the Welfare Assistance Service. This is a service that was devolved from the DWP in 2016, and it previously was managed or run through Hearts Help. Due to the cost of living crisis, the number of calls coming into Hearts Help actually overwhelmed the service from its original intention. We had 91% of calls were relating to cost of living. So we made the very tough decision to make it into an online service. I should state, for those that cannot fill out the form or are uncomfortable filling out the form, you can still ring up Hearts Help, who will fill the form out on your behalf. And they will arrange for a link worker to go and look at the documents. Or you can contact a specific team in Age UK Hearts, who will fill it out on behalf of older people. The criteria used to be, before the HSF funding, you had to be on benefits, or your net income could not exceed £293 per week if you were single, or £482 if you were a couple. However, with the just about managing, so we are now ignoring that. Each case is reviewed on its own individual basis, as long as we have the HSF funding. It is intended for adults. It's an 18s or over service, but we do bend that rule. We supported a 17-year-old recently who'd been rehomed due to domestic violence. And the oldest client we've ever had is 102. We also support people who don't reside in Hertfordshire but have been rehoused from the county as a result of domestic violence or homelessness. And we will support people that live normally outside Hertfordshire but have been rehoused into Hertfordshire. Next slide, please, Matt. So this is what it currently provides. It provides food, energy support, home and kitchen starter packs. Those are things like pots and pans, or it's intended for pots and pans, pillows and duvets, etc., etc. You have to have moved into the property within 3 months or been made homeless as a result of domestic violence to qualify for those. We do cots and mattresses. They are for babies and single beds now. And we do support towards the cost of replacing white goods up to a maximum of £200. The reason we've stopped replacing white goods is that the DWP wanted us to concentrate on food and energy over white goods, and we were spending a lot of money on white goods. It's intended as a one-off intervention. However, people can come into it 2 times in 6 months, sorry. The first application, they'll just be helped and assisted, assuming they qualify. Second time they apply, they must accept a referral to the Citizens Advice for Debt and Benefits, as they obviously have an ongoing issue. And the third time they apply, they must have either attended the CAB issue or have it pending. We do get people that take the referral and then cancel it, and they unfortunately can't be supported. Next slide, please, Matt. So applicants need to provide the same as they always have had to provide. So when this was a telephone service, they had to provide all this stuff, proof of identity. We do ask for photo ID now. The reason for this is we have experienced some attempts at fraud where ID has been provided, which is not good enough. If they can't provide photo ID, we will accept an email from a professional with a professional email address. So, for instance, a hertfordshire.gov.uk address saying that I know this person and this is who they say they are. We ask for proof of their benefits, proof of their finances, proof of their address for utility bills. We do ask for a tenancy agreement if they are claiming white goods support. And the reason for that is so we can see they've moved in within the last 3 months. Or also to see if the landlord is actually liable to replace their white goods. Next slide, please, Matt. So as I said earlier on, we've moved from 3 applications in 6 months to 1 application in 3 months or 2 in 6. We removed the white goods, so it's now down to £200, which is towards the cost of repair or replacing. Yeah, you can read everything that's there. We've had to join the shared anti-fraud service. We have had 2 attempted frauds, both of which have been dealt with by the shared anti-fraud service under their remit. The service, as I say, is open to anyone over the age of 18. And we normally have a budget of £140,000, which currently we would spend in 6 weeks with the current rate of spending. And that concludes the presentation on the Welfare Assistance Service.
Thank you, Michael. I'm going to hand over to Matt Mardell, who's going to talk about other support, including food banks.
Hiya. So in addition to all the support that's just mentioned, there is a lot more support available, and this can be found at the Hearts Directory. This is an independent online tool where you can search for support. So if you want food support, for example, you can use the filter at the top and search by your local area to find food support near your clients. I've just put a few tips on the screen here. It's really important to use the filter. It does only show 10 results at a time, but if you scroll to the bottom, you can click on the next page and keep going until you find one that is relevant to you. The Hearts Directory itself is being enhanced and it's continuously being reviewed to see how we can improve it for you. And some of the services, as you can see, do have a referral button on the directory, and you can shortlist lots of services that you think are relevant to the clients that you support so that you can easily access them in the future. So warm spaces are continuing this year, and there are grants out through Hertfordshire Community Foundation for organisations to apply. So there should hopefully be more organisations come in as warm spaces on the directory. We have got a web link in the slides that you can use to take you directly to the web page. But again, it uses the Hearts Directory. these are safe, warm spaces that people can use in the winter to help them keep their energy bills down. Many of them offer warm drinks as a bare minimum, or possibly warm food, depends on the one that you go to. And they might have lots of information to help support with lots of useful leaflets and flyers. So you can also find food support on the directory, and we are looking to enhance the food support at the moment. So there is work going on to map the food support around Hertfordshire and get these on the directory. So again, there should be a lot more coming, and hopefully you'll be able to find ones in areas relevant to your clients. We also have a regular food aid network meetings where we work together with the food organisation to try and support them and make sure that we are actually getting the support out to clients. So if anyone wants to join that, you can contact me. My email's in the slides. And we're also looking at developing a community supermarket scheme in Hertfordshire. Again, that information will be shared and it'll be uploaded onto the web page where the slides will be, and we'll hopefully be able to share more information about that in the future. But it's very much a community supermarket layout where people either pay a monthly fee or it'll be a very much reduced price to make sure that it is a food affordable and accessible to everyone. So we also have cost of living flashcards. These are really much tools for professionals. So as you can see, they tell you some key support that is available and where you can go to access them. We have tried to put phone numbers on every service, but unfortunately, some of them don't have direct numbers. So if there's not a phone number on there, you can contact Hearts Help, who are on the cover page, and they can support you with accessing those services. We can get these sent out to professionals if you'd like some. You can just email the community wellbeing at hertfordshire.gov.uk and we can arrange some to get delivered to you so that you can share with your clients all your services. And I'll now hand over to Michael to discuss Hearts Help.
Thank you, Matt. Very quickly, Hearts Help is a single point of access to the voluntary sector and both statutory services as well. If you have anyone that doesn't know where to turn to, we advise them to call Hearts Help and they will provide assistance. It's as simple as that. It is a no wrong door approach.
Many thanks to all our speakers there. I know that we've just given you quite a lot of information. As I said, all of the slides and recording of this webinar will be on the cost of living website on the Hertfordshire County Council, on the cost of living webpage on the Hertfordshire County Council website. The link is on there. I'm just going to open up to questions, and I can see that we've got questions at the moment. Apologies, there's quite a lot of people. Stacey, you've got your hand up. Would you like to come in and ask your question?
Yeah, I'm working the leasehold team. We've got a lot of pensioners, leaseholders that this year more so than any other year are struggling. What I've noted is that quite often they feel that there's other people out there that might be struggling more than them. So trying to get them to agree to referrals, you're really having to point out, like, nobody knows the answer to that, so let's just do it. But I don't think they always know that they need to apply for service charge under the housing costs. And I've been on many welfare and benefit debt advice courses as well to try and get to the bottom of what the parameters are for that. And it seems to be, they do need to put it through as housing costs, but it seems to be dependent as well on who you get on the other end at the DWP. So I don't know if you've got any more clear sort of legislation or guidance on that.
Thanks, Stacey. I'm going to ask Gary if he could come in on that.
Yeah, even after I was doing the slides and I was reading my own slides back as I was talking, I was thinking, I didn't mention that not just getting attendance allowance or care or getting underlying entitlement to being a carer can boost that pension credit basic figure of 218.15. So can certain housing costs and certain service charges. it's not service charges for things like gas, electric, water, but it can involve things like a service charge that's been applied to do repairs, for example, a service charge that is on there to cover ground rent, for example,
or buildings insurance would be a standard.
yeah, and where it's shared buildings insurance, not contents insurance, but buildings insurance. Yeah, there is guidance on it, and if you drop me a line, Stacey, at the Money Advice Unit, just gary.vaux@hertfordshire.gov.uk, I'll send you what information we've got on what service costs can be added to that pension credit baseline figure, so that it makes somebody more eligible for pension credit than they otherwise might realise. I mean, what sort of level of service charges do some people have that you're coming across?
It can be as high as up to 1,500-1,600 a year. And
right,
we've got,
which is like 30 to £35 a week. Well,
yeah,
you know, that in itself would lift somebody's pension credit from, you know, below the state pension level to quite a bit above it. So
and as
yeah,
a standard, so all of the inflation costs for insurance, the whole lot of all communal electricity, they're all outside of everyone's control. They've all gone through the roof. And particularly with insurance, it's getting harder to find providers, so it's not as much competitive in terms of price, etc.
Yeah.
And what I've noted as well is that, well, one, the pensioners don't seem to know that they should be included in that, and the battle of getting them to understand that they are entitled to additional help. But this year, more than any, we're seeing way more pensioners reaching out to say bills are completely unaffordable for them now.
Yeah.
And I'm seeing people making the choice. They understand the service charge is important. It affects their security in the property. They're making the choice between paying a service charge and picking their heating, for example.
Yeah. Well, hopefully with a bit of advice, we may be able to get them both. But yeah, drop me a line, Stacey, and I'll provide you that information.
Thanks, Stacey. Thanks, Gary. I think that'd be hopefully that can work out in terms of reaching out to Gary. Aware that we've got two other hands up, so let's hope we can get these in. So Kate, you were next. Kate Newton.
Undo my mic.
Oh, there you go.
Can you hear me?
Is that right?
Yeah, so one of the big, so it's Kate Newton, St Albans Old People's Trust. As you know, we give grants to older people who are poor in St Albans, and the big thing for us is digital exclusion. And so it's not really a question, it's a bit of promotion. We have produced the Old People's Guide to St Albans, Silver Pages, and it's just got tons of information and case studies, because we know that you can give older people all the information that they could possibly need, but they don't actually believe it applies to them, and therefore they won't apply for things. And we've got an event. I've just put it in the chat. I put it in the chat. It's one of the first things on the chat up there. We've got an event on the 20th of November, 1 till 4, and we're giving away our 4,000 copies of our guide, which contains all sorts of information, including Money Advice Unit, loads on Age UK, loads on Castad, Citizens Advice, just loads about benefits. Anyway, that wasn't my question, that was my plug, sorry. But it is kind of a thing, which is how do you get to people who aren't digitally included, and how do we get all this lovely information to them? Thank you.
Thanks, Kate. So that's the work that we're doing with Age UK around the road shows and some really targeted outreach. But you're absolutely right, Kate. That is one of our issues. And again, hopefully webinars like this will mean that professionals and people out there can spread the message. We've got the flashcards. We're going to hopefully be doing some leaflet drops as well. But absolutely, I think this is very much a multi-agency system wide. Let's all work together on this and try and get that information out there. But Kate, please do, I'll drop you an email, and please do come along to some of our cost of living meetings and do join in with them. I just want to take the last, really, hopefully we get to squeeze this in. Karen Brennan, did you want to come in and ask your question?
Yeah, it's just a quick one, just to clarify. I've got a client, an adult care services client, who's had his attendance allowance stopped last October and then reinstated in April. He's got a large electricity bill he can't pay. He says he's not on pension credit. That was stopped because of attendance allowance, which doesn't make sense.
No.
Would that referral go to adult for the money advice unit because he's one of our clients? Or would I send it to... It's also a barrier to him receiving ongoing care, which he needs. So would I refer to you?
This is where I'm going to pass the buck, I'm afraid. We can't take at the moment referrals for older people, even if they're getting ACS services, because we're having to limit what we do according to the funding we get. But we do have very good relations with both Citizens Advice, who've got an appeals officer, and with Age UK in Hertfordshire, who are doing some terrific work around not just pension credit, but attendance allowance. So it really does sound like I am passing the buck, because actually that is what I'm doing.
No, that's great. I just wanted to refer correctly in the first place so that it goes, doesn't zoom around, so that I can refer to HUK then for him. All right.
Karen, we'll make sure somebody contacts you from, we'll have a chat with Mark from Age UK Hertfordshire. We'll make sure somebody contacts you.
Yeah, because he doesn't do online and he's not, doesn't seem, okay, brilliant. Thank you.
We'll make sure we'll drop you an email, Karen. We'll make sure we get you the right support for your for the person that you're supporting. Right, really aware that we have 1 minute to go, so we've run out of time for any more questions. However, please, we've got the community wellbeing emails, so do drop us any, if you have any questions, do come to that. Also, if you want copies of the flashcards, which are kind of like little postcard sizes with the information, again, do drop the community wellbeing email address and we'll get some copies out to you. Again, all the information is on the cost of living page on the Hertfordshire County Council website. Thank you so much, and like I said, please do reach out if you have any questions, and if we can support anyone through this cost of living crisis. Well, it's a very long crisis now, isn't it, that we're in at the moment. We really want to make sure that we support people out there. So again, please stay in touch, everybody, and thank you very much for coming. Bye-bye.